If we hear the word heroin, we think bad drug, stay away. If we hear the word, Oxycontin or Vicodin or Percocet or any of these products that are prescription drugs, we don't have that same reaction.
The prescription drug abuse problem has exploded in the community. And again, it cuts through all levels of the community, all socioeconomic levels, all education levels, because of the ease of obtaining the drugs.
In my mind, opiate addiction is the most serious addiction crisis in our state, and it is probably the most serious healthcare crisis that our state has ever experienced.
I got to the point that just to function, I had to have it, just to feel normal. I couldn't do normal daily life tasks like getting out of bed, getting a shower, driving my kids to school, cleaning house, fixing supper. Felt like I couldn't go to Walmart without having an Oxy.
The disease of addiction wants to kill me. Still to this day, wants to kill me. That is its ultimate goal.
This can happen to anybody at any time. Whether you've done it once or 100 times, it can happen. And no other family or group of friends or community needs to know what it feels like to lose a young person.
It doesn't hit home until it happens to you.
I saw a figure from the Centers for Disease Control and Prevention recently that in 2010, enough prescription painkillers were dispensed in the United States to treat every American adult over 24 hours a day for a month. Every American adult, 24 hours per day for an entire month. I mean, the number of products that are out there are kind of staggering.
We had a normal family growing up. I was raised Jewish. I had to do a bar mitzvah. My parents were, a big support of that. They were supportive of all my schoolwork, and, I had a pretty normal upbringing. I took some shrapnel in the neck, the ribs, hand, wrist, arm, broke my back, messed up my knee, ankle, and hip. I was on 1,000 milligrams of Oxycontin a day, which would be 8 80s, 8 30s, and 10 10s every day, and that was prescribed. I kept going to 2 separate pharmacies, and I had like 2 doctors writing the same script, and a pharmacist caught it. And when they called the doctors, they could no longer write them. And when that happened, I was buying pills for a while after that. And then I was introduced to heroin. I shot it in my neck, and I missed once. And the reason these scars are so deep is because it inflamed, pushed whatever metal was left in my neck onto my jugular. They had to cut back into it and take more out. The disease of addiction has 2 parts. From my understanding, there's the obsession and the compulsion. The obsession are the thoughts, the racing thoughts to use, the want to use, but those pass, those are just feelings. The compulsion, that's the beast. The compulsion is once we start, 1 is too many, 1,000 is never enough. I never really used drugs in high school. Actually, I didn't use drugs in high school. I drank a little bit. I never used drugs in the Army. I drank a little bit. But the second I put that painkiller in me, it was love at first sight. My wife thought midway and in the end that I was cheating on her, and I was. It just wasn't with a woman, it was with the drugs. They had become my lover, they had become my wife. I told my family I had cancer, because I looked like I had cancer and I needed money for drugs, and I wasn't the one to, I was like, I can say that I didn't want to rob people, but if they hadn't done that, I would have. There's only, in the disease of addiction, there's not yets. There's all kinds of things that I say and that people say they'd never do, but it's just a not yet. I could not get clean until I was in despair, and I had no other choice but to die or get clean. If I can continue to do what makes me feel good with no consequences, there's no way I'm stopping. If there are consequences, you either sink or you swim. That's it. Dealing with consequences is a big part of recovery. So when you're clean, you get to experience life again. So my worst day clean is still better than my best day high, because my best day high, I was high and I didn't know what the hell was going on. I couldn't enjoy it. It's like for every minute you use, every minute of euphoria I got from using, there was 5 to 10 minutes of misery that followed. That is a sucker's bet. From my understanding and from what I've seen, there's only 3 places you go once you start using. And it may be slow, it may be quick, but you either go to jail, you go to an institution or a treatment center, or you die. And I've been to 2 out of the 3 of those. You know, the only thing I haven't done is died yet, and I've come damn close.
Opiate addiction is a serious and potentially life-threatening condition. Families need to understand that, and persons who are addicted to opiates need to understand that. If, as a parent, you suspect or determine that you have a child or a family member that is using opiates, they need to immediately seek help from a professional.
There are many resources available. There's a group called the Substance Abuse and Mental Health Services Administration. It's called SAMHSA. If you go to this is a national group. If you go to their website, they have a directory and a kind of geographical directory of treatment centers. You know, if I'm trying to find a treatment center, how do I do it? Actually, this Substance Abuse and Mental Health Services Administration website can be a helpful tool.
It's like saying you can drag a horse to water, but you can't make it drink. You can order somebody to treatment, but until that person decides they're done and surrenders, I have acceptance that this is a disease, that I'll have this disease my entire life, and that I need to continue to take my treatment the same way as a diabetic takes their insulin.
Many adolescents experiment with alcohol and drugs. That is a common occurrence in virtually every city in our state and across the nation. The problem is when they experiment with opiates, the likelihood or the chance that they will become addicted and engage in life-threatening behavior is much greater. It's much higher than if they engage in binge drinking or other forms of addiction.
It was very easy to get along with Cole. I mean, the moment you met him, you felt like you'd known him for years, and he was just so outgoing. You couldn't help but fall in love with him.
He's one of those kids that he just knows if something's wrong, especially one of his best friends. And like she said, he just goes to you and he just will ask you what's wrong and he'll help you out.
When you speak to a child today, you say, hello, hey, such and such. They'll say, hello, right? That's not Cole. Cole would say, I say, hey, Cole, how's it going? I'm good, Kevin or Mr. Crockett, how you doing? How was your day? He followed up. I'd never forget that. I will never forget that. The only young man that I know would do that all the time, every time I saw him.
Cole had the potential to do whatever he wanted. He made great grades, but he really didn't have to crack a book. He was in all honors classes.
He told me what he had and that he couldn't wait to get home and do it. And I told him that, you know, it's stupid and not to do it and stuff like that. But I didn't put the point across like I should have.
As soon as Cole walked in the room, I knew immediately that he was under the influence. I had been going to school for nursing and I was getting ready to start a program, so I had had a lot of classes in anatomy and pharmacology, so I knew the signs and symptoms. And I noticed that his pupils were pinpoint. He was pale, he was shaking, and when he did start to speak, he was slurring his words. And so that's his first encounter with Cole that day, that he was already under the influence when Dad came home.
So we took him to the hospital, and you know, they did the treatment that they performed there, and then they released him. He was still very much under the influence, but the hospital at the time thought that he was okay to be released. I gave him a hug, and I told him that I loved him, and I told him that everything was going to be okay.
I knew right away. I could see the symptoms of what had happened. His foot was out of the blankets, and I saw the modeling on his foot, and I knew that he wasn't circulating his blood, and then saw his lips were blue. And so I knew that more than likely he was dead, but my mind couldn't wrap around that because my kids are my life, and how could this possibly be? So I felt for his pulse, and I couldn't find it on his wrist. And so I'm feeling on his neck, and I couldn't wrap my mind around the reality. So I yelled to Shane, and he came running up the stairs, and he's dialing 911, and right behind Shane is Eric.
I saw that they were both in Cole's room, and so I saw he was already in his bed, and he had already been dead. They called the paramedics, and they told him to pick him up and put him on the floor and do CPR.
You know, they asked if I could give the 2 breaths, and you know, that's the image, you know, you carry to your grave is when you close your eyes and you look at your son, and the last image that you have of your son is with his purple lips and, you know, blood and fluid running out of his mouth, and but as a father, you know, you don't care. You get all that stuff out and give him the breaths and start the compressions, and continued until the paramedics arrived.
I wish that, you know, I could have just stopped the pill.
My 14-year-old son has asked me things like, Mom, what do I do on my wedding day when my best man isn't there? Eric at 14 asked me, how can I explain to my kids that they don't have an uncle and they will never have the cousins that they should have had because of one bad decision, just one?
Cole wasn't like a big party kid. He wasn't one of those kids that liked to mess around with stuff like that. And I mean, our group of friends we're not big party kids.
The fact that this was one pill, one time, is exactly true. When we got the toxicology back on Cole, it corroborated what Danielle had told me. And it's such a tragic story of how just one bad choice can end a life.
The young man that gave Cole the pills, he was a family friend, and he is a family friend. We love this young man, and this young man has to live a very altered life than what he had before. He has to know that he gave Cole the pills that ended his life, and we don't blame this young man, and we don't blame the kids that knew that didn't say anything. Only Cole is responsible for what he did.
I feel like if I was a better friend like I should have been, then I could have done a lot more. I could have called him, I could have talked to him more, because I know other people that has passed away from drugs. So I just think that, you know, I could have done a lot more for him. I could have saved the life of my best friend and, you know, saved a life.
About 5,500 Americans aged 12 and under will abuse a prescription painkiller every day for the first time. 5,500. So how can we get in front of these people, many of them being teens, you know, young people, and educate them about this?
I think as humans we're non-confrontational. We want to avoid saying hard or critical things about people. And the fallacy with that, or the problem with that, is by not doing it, you may end up killing them. You may end up missing an opportunity to save someone's life.
I use the example all the time. When my kids were growing up, we always locked up the alcohol, you know, but we didn't lock up our prescription drugs. We left them in the medicine cabinet. Well, these things are just as potentially harmful as alcohol. I mean, alcohol's a problem. But, you know, are painkillers a problem, and are people dying from it? You know they are.
Leslie, her first knee surgery was when she was 8 years old. Her kneecap would fly to the side and to the back of her leg. If she was running, it would just snap and she would fall. So they had to do an emergency surgery and pull tendons and muscles down to straighten her kneecap up. And then when she was 10, she had her tonsils, adenoids, and her appendix taken out. She was married in 1996, and then in 1999, she was blessed with her son, a baby boy, and when he was 10 months old, she had to have a complete hysterectomy. After that, she just began to spiral down because of the pain medicine that she was on so much. Between 2000 and 2006, Leslie had 5 knee surgeries. In 2000, I tried to get her to get off of taking pills. You know, that's when she started really taking them more and more and more.
He was 13 when I found out for sure what he was doing, that he was drinking and smoking pot. He came to my house drunk and high, and I confronted him, and he just got angry.
It got to the point where she lost her son. She lost her husband, she lost her home, and our family was just completely tore apart. And she would sit and cry and tell me that she didn't want to do this. And then I would think again, there's hope. And then the next minute, my friend would tell me that when she was there, she stole some of her pills. So then I'm right back where we started from.
Well, at about 10:45 that night, I was in bed, but I wasn't asleep. My younger son, who was 14 at the time, I guess, he brings me the phone and he says, "Mom, New Boston Police Department wants to talk to you." It was the police captain, and he told me that I needed to get to the hospital right away. My son Wes had been in an accident, and he was very critical.
It was on a Saturday morning, 8:30 in the morning. Her friend Jennifer called me. And told me that Leslie was dead. I had no clue what was going on. I had no clue why she died. Jennifer just said my daughter was dead. That's all she said.
He was at his house and he was partying with friends. There was just 3 of them there, and just one of them had recently left. So him and 2 other people was at the house, and they were drinking and they were smoking pot and they were taking pills, and they were very much under the influence. And Wes had traded for a gun because when people knew he was dealing, they started breaking into his house looking for money and pills. And in the state of mind he was in, he said, if somebody, breaks in, I'll shoot him. And he got the gun out and was showing it off and playing with it, and it discharged and it hit him in the head. In the ICU up there in the head trauma unit, there's no even rooms to divide. There's just a curtain and no walls, I meant. I pulled the curtain and I climbed in bed with him and I sung to him. And I teased him still. I said, "I bet you don't like this, me all cuddled up with you singing to you, but you can't stop me, can you?" And I guess I was crazy at that point. I'd laugh a little bit, and then I'd just sing to him, and I kissed him on his lips. And I walked away. I said, "Goodbye, my son. I always love you."
Was I wrong by allowing those doctors to give her the pain medication when my daughter was 8 years old? I think of that. But yet, as a parent, you don't want to see your child suffer, and you don't want to be in pain. And you think when a doctor gives your child an 8-year-old Tylenol 3 with codeine that he knows what's best for your child.
Anytime a patient gets a prescription of any kind, I mean, we've got to be better advocates of our own health, and it's just the way it is. And I think, you know, if we can train our patients to ask questions for anything, you know, so if I'm getting a diabetic medication, I need to understand what it is and how it works and how I should take it, and other drugs that I can use it with, all those kinds of things. You know, we're taking all these prescriptions in our country, and we're living longer and healthier lives because of it. But these drugs cause problems.
We need to make sure that we don't get more medicine than we need for acute conditions, and that when we do have medicine that we don't use, that it's disposed of immediately so that it doesn't pose a threat or a risk for adolescents that may have access to our medicine cabinets.
The best way of disposing of them is to incinerate them, which most of us obviously don't have the capability of doing. Other ways of disposing them on our own are to put them in some noxious compounds, and people will talk about coffee grounds or kitty litter. You know, mix them up and put them in the trash. I mean, that's another way to do it.
There is a general sense among people in our society that if a medication is prescribed, that it is safe. And so we do have many medications like Oxycontin, which is, for all intents and purposes, identical to the illegal drug heroin that people have access to, and they really don't have a clue about how dangerous those types of drugs are.
There's a stigma attached to addiction. A lot of people, if they've lost somebody to a drug-related death, they don't want that to be known. They keep it from people. I never looked at it that way. I just always felt that the right thing to do was to tell exactly what had happened to my son.
They say she done it to herself. Well, she may have done it to herself, but death can be prevented, and she was a human being. And no one is exempt from death. No one's exempt from drug addiction. Anyone.
I consider our family a typical middle-class family, you know, as I described before. And I think there's a stigma out there that that would maybe degrade our family, or we would be looked upon differently. But I can tell you, after Cole's death, I could care less.
Parents in general need to understand that they are not the cause. Nothing they did was the cause of the addiction of their child. The addiction occurred as a result of multiple factors playing into that child's life.
There's always somebody innocent, you know. I'm not an addict, but I lost my son. I have to feel that pain. Is that right? You know, did my son deserve to die because he had a disease of addiction? SOLACE stands for surviving our loss and continuing every day. And what the word solace means is to seek comfort. We need somebody who can speak for the families, somebody who might start a support group, because there's many people who's lost somebody to drugs.
So I got a hold of Joanna, and she said, well, what all you can do, if you want to come, we'd love to have you come to our meeting. And I did. And I was welcomed with open arms, love, and support. And they listened to me. They felt my pain. They knew the pain. They understood the pain. And we were like a big blanket engulfed in each other, because that's how peaceful that it was at that meeting. I knew that I wasn't alone.
In the beginning, she did intend for it to be prescription drugs, but it has expanded to where it's just drug-related deaths because people have been killed and murdered for drugs in their home or robbed.
We have people in the group who have a family member that's currently struggling with addiction. We have family members who have a child or a loved one in recovery. We have recovering addicts in the group, and we're so very proud of them. They go around and speak with us and tell their story. So we're not just for people who have lost, we're for anybody, and anybody who even wants to make a difference in this fight against drugs.
They had a community memorial service for anyone who had lost someone to a drug-related death at a church, and I went to that ceremony, And that's the first SOLACE event that I was actually at.
One's enough to start a SOLACE group, I think, because if you've got that one parent that's willing and wants to pursue it and wants to push, they're going to get out there and they're going to let their voice be heard. And then once they start letting their voice be heard, then you'd be amazed at the people that start coming out and saying, well, that happened to me. Let me help you.
It helps me to keep my sister's memory alive, but also to not let her death be in vain. It's the greatest thing I've ever been part of.
We had about 300 contracts made and written a couple of days before the funeral that we were going to offer the kids an opportunity to sign that basically said that they were going to do two things. One, refrain from using drugs themselves, and then two, help somebody else by telling, don't be the innocent bystander. And that's kind of the fundamentals, the two fundamentals of Cole's Warriors.
We knew here that we had a problem. We're aware that we had a problem, and we were doing the best that we could to attack the problem. It wasn't until Cole's death that we had the right combination of passion and drive to really kind of bring everything together and attack the problem. So now we appear to be headed in the right direction, and hopefully Danielle and Cole's Warriors will provide a model that other people can follow.
I hope that it has the recognition of Megan's Law and the Amber Alert. I hope that it's a name that is well known, and when you hear the word Cole or the name Cole, that you instantly think of drug prevention, prescription drug prevention.
We have an obligation to change things that are wrong in our community, and you see this as being prevalent in your community, you have to take the time and make it happen.
I dealt with a lot of drug users. What I can tell you with absolute certainty is that each and every one of them are human. Each and every one of them have personal lives. Each and every one of them have reasons for doing what they do. Sometimes what they do is a mistake, obviously against the law. But until they speak up, until the addict, the drug dealer, the parent, until we speak up and we become part of the solution, we remain part of the problem.
Don't wait till drugs, comes into your family before you join SOLACE or join a drug action team. Do it now, Do it now before it even touches you. Make a difference now to the people who have the problem.
You could have had me for a song, 'cause my love was so strong. Though the years have come and gone, I'll leave a light on for you. I remember the day you went away, and I missed my chance to say that I'd leave a light on for you. And how I wish that I'd known how quickly life moves on.
Ride your bike.
And how I wish I'd been brave enough
Ride
to
fast,
try
Cole. Go
and
faster.
make you stay.
Look at you, Cole, you're riding your bike.